Tony Tukumbo Fernandez Show is all about promoting the true life and success stories of African and Caribbean achievers around the world. If there's a product or initiative you wish to share, feel free to give us a call. The number is 0788 280 9005. A very warm welcome to all our listeners around the world. You're welcome to the Tony Tukumbo Fernandez Show, promoting the true life stories of people making a difference around the world. So if there's a project or initiative you wish to share, feel free to give us a call. The number is 0788 280 9005, or visit our website at www.myfernandez.com. And each week we're in different cities interviewing great community champions around the world. But this week we're sticking to my home city here in Bradford to speak to the amazing Dr. Jamilla Hussain, who is a consultant for medicine, pathological medicine, and a senior research fellow at the Bradford Teaching Hospital Foundation Trust ever since April 2002. And several campaigns are so close to her heart again. So, Dr. Jamilla, it's lovely to see you this evening, looking rather relaxed. How are you today?
Good evening, Tony. Yeah, thank you so much for inviting me onto your podcast. I'm good. Yes, I am relaxed. It's a Sunday evening, so I'm getting out of putting the kids to bed. So thank you for that.
Most importantly, I hope you had a very peaceful Eid.
Thank you. Thank you. Hair Mubarak. Yeah, we did. We had a really nice Eid. Thank you.
Okay. So our show goes beyond Bradford, a lot of the time beyond UK. So just for the benefit of all our listeners around the world, can you just tell us a bit about yourself, your background, and the things you're passionate about in life?
Yeah, so my name's like I say, Jamila. I'm of Pakistani heritage. So my parents were lived for many generations in Pakistan, but they came over, and I was born in England, in Yorkshire. I'm a palliative care specialist, so I'm a doctor working in end of life care. So that's looking after people in the last years of life, right until the moment of death, but also where we support bereavement support for people afterwards. The thing that I'm really passionate about, I guess, post COVID has been around inequalities at the end of life in terms of the healthcare services and support we provide across the UK. Um, there's huge inequalities in access to good palliative care, and even when ethnic minority communities do access palliative care, we don't always provide the kind of support we need for different communities. So I've been doing a lot of work, a lot of research really on what are the inequalities at the end of life and what matters to different communities at the end of life, and how can we transform our services to meet the needs of those communities at the end of life. And at the moment, as you know, Tony, we've talked about this before. There's an assisted dying bill going through Parliament, and I've been doing a lot of work, again, trying to raise the voices of the most marginalised to make sure policymakers understand the impact of any law on these communities so we can make it as safe as possible.
With regards to that dying bill, bill that's coming out soon and everything, what's been the journey like so far? What were your experiences like, and what were the greatest lessons you learned in that experience itself?
Ooh, a good question. What did I learn?
Because it's on TV quite a bit, really. And I know when we spoke last year, sometime last year, it wasn't that much on TV.
Yeah, so it was quite unexpected. Um, so there's about 15 countries in the whole world who have legalized assisted dying, but they're all Western countries. Um, and the UK, well, England and Wales haven't as yet, but it was quite unexpected that it came so early on in this kind of in the Labour government's kind of time in government. It seems to have come from Keir Starmer making a promise to Esther Ranson, who's a celebrity who has a terminal diagnosis, who to have a free vote for MPs on this issue. Um, and I guess my journey started. So in January, I was invited to give evidence to the committee in Parliament about the impact on marginalised communities, and to inform that. I went back to those communities that I've been working with across Bradford. So that's Pakistani, Bangladeshi. We had people consulting the Sikh community, Black African, Black Caribbean, as you know, Tony, as well as Eastern European and Roma communities to ask them their views on the bill. And what was really interesting is they all said the same thing, first of all, which was we're really worried. We're worried, especially post COVID, that this will be something that's forced on our communities more than other communities. Um, and the other thing that they were concerned about was the role of family. Family is really important across all these communities. And decision makings, we know often we are trained as doctors about this individual person in front of us, what is their choice? And that's what matters. But actually, what we're learning more in end of life care, and I know personally from my own family's experience that in many different cultures across the world, decisions are made as a collective, as a family, as a community, and that's really important. But this bill doesn't do that, so families don't need to be involved at all. And actually, the impression from the people who are developing the bill is that families will coerce people out of wanting assisted dying. And the worry there from the community members I spoke to was, well, of course, I will try my best to make them want to live. Or if their needs, if they're saying I'm feeling a burden, I heard this a lot, then it is my job to make sure they don't feel a burden. And so there's this real tension because actually families often are just, what I find in my practice is families are wanting to do the best for the person, and the person who's dying is wanting to do the best for the family. And my job as a palliative care clinician is to bring those two together and get them to see that and then work together. And you can feel the relief in a room when someone makes the space to have those discussions. But at the moment in this bill, the people don't have to see a palliative care team because there's not sufficient numbers and there's no kind of provision for family involvement. So yeah, so my having done that first bit of consultation, we've gone on to do a few more consultations that you've thankfully been helpful with as well across different communities. And I guess my journey and what I've learned from all of this is, I really thought I didn't expect MPs and policymakers to really understand what happens on the ground, especially for those most disadvantaged. But I've worked really hard to inform them of that. And I guess the hard lesson for me has been that that still isn't enough. That MPs are making decisions based on their own values and based on what they think is right. And actually, if we don't have MPs that are representative of these communities at that decision making table, it's really hard to influence. I could give them all the evidence in the world, and it's just hard to make it hit. But we've been really lucky in Bradford that Naz Shah, one of the local MPs, has worked so hard. She got herself on the committee, and she has been one of these people who's really been trying to champion understanding about the wider implications.
I mean, taking all that into consideration, how important is it today? The voices and the aspirations of ethnic minority communities in UK. How important is it and why? Taking what you've just said into consideration.
I think it's essential. The reason I guess I'm doing all this work on top of my normal work. Nothing in my job plan says I should be doing this work really. But the reason I do it is because I'm from this community. The reason Nasha's doing what she's doing is because she's from this community. The reason you've got me on here is because this is going to affect your community. So I think it's really important. like this is one of the hard lessons is, and I think especially as the political landscape is changing in the UK, that more than ever we've got to rely on ourselves and we've got to come together and we've got to work together and we've got to not be disheartened. We just have to dig deeper.
Okay, and digging deeper sometimes also, we always yearn for that spirit of inclusion as well. Uh, what would you say it takes for our society or societies in the UK today to become more inclusive? Not just on words, but in action.
Um, I think the first thing that comes to mind is it needs to play out at every level. So it's got to play out within our communities, um, seeing that we all have more in common together than differences, including, I don't mean just ethnic minority, I mean including white British community. The things that is disadvantaging us the most are very similar, but also the strengths. So if, I grew up in an area that had very poor area that had pockets of very poor white British areas, and I went to school with those people. I have much more in common with those people than I do with the people that I've been meeting in Parliament, because we have to come together and be inclusive and see our common humanity. It's got to also happen at system and wider society level, that we need those leaders to really value this. So I feel we've been through a period post-COVID where people have been really open to this discussion and action around inclusion. And I can feel that window of opportunity is now narrowing. And I think it's important that we, like I say, we don't get disheartened. It's more important than ever to use that language. It's more important than ever to talk about the action that involves that, to set that tone of this is something that is essential for the whole of humanity, actually, not just for those who you're trying to include.
And we feel very, very proud, especially here in Bradford, that you've also taken it upon yourself to be involved in these campaigns as well. Uh, Rounding off now, I mean, what initiatives have you got lined up, say in the next 6 months or 2025 itself?
So there's a few things. So this assistant, today I've been writing emails to MPs and I've been messaging MPs today. On Friday, this assisted dying bill is going back to Parliament. There's a huge chance the MPs are going to vote on it. So we're still doing all that work, and this week's going to be a big week for that, to get MPs to really understand the implications of this and how perhaps we could have a safer bill. But as well as that, I think it's really important for me. What I've noticed is when I've been working with these communities, especially in the most disadvantaged areas of Bradford, is assisted dying is a tiny thing for these communities. There's huge inequalities in access, not only to palliative care, but to health services in general. We've talked a lot about access to GPs and A&E, access to benefits. There's huge things that we need to be doing within these communities. So we've got a project coming up where we're working with a Pakistani women's group who have done a couple of projects around death and dying. And then the next project is going to be them making videos for other women in their community that they're going to share about the things that they've learned. As you know, we've started a 5-year project, Tony, that you've helped me with around anti-racism. So developing an anti-racism framework around end-of-life care, because we know that racism exists. We hope it would be when someone's on their deathbed, the racism that we face from the moment we're born would suddenly disappear, but sadly it doesn't. So we're doing a 5-year project to understand what it would take to address that at the end of life. We're doing another project where we're recruiting people across Bradford with frailty who are over 65, and we're going to follow them up right up until for 2 years, including if they are deteriorating and start to have a shorter time of life, to follow them up to really understand what factors influence your well-being. So, but not just your physical well-being, but your mental well-being, your emotional well-being, your financial well-being, to really unpick what are the things that we need to do to support these people. And lots of other projects, but I feel like I could probably talk for another 20 minutes if I tried to include it all. But that's some of a flavour of the stuff that we're trying to do here in Bradford.
Well, that's amazing, Dr. Jamila. I'm so proud of you and all your great work. On a very final note, what message you have for all our listeners around the world today?
Oh, well, I guess before I came on here, I was just looking at where the Freedom Flotilla that Greta Thunberg's on, as it approaches Gaza. And I guess my main message to all of us is that we need to keep speaking up. We need to keep helping each other, and that love and care and solidarity is absolutely what we all need to be championing, and we all have a role in that.
We all have a role in that. And once again, wishing you an amazing week ahead, and we'll catch up soon. And God bless you.
Thanks, Tony. Thank you.